Hi everybody, it's Susie. It is Wednesday, November the 10th. Tomorrow I'll be 7 weeks post-op from my lumbar fusion. And I followed up with the doctor on Monday, just 2 days ago. I went in to see him because I've been having a lot of pain since I fell. It didn't happen, the first couple days, but then I really have been having a lot of pain. And like I said in the last video, I wasn't sure really if I was just doing too much, if it was because the pain medicine had been cut down, was it because of the fall? So I finally called the doctor's office, and the hospital had never faxed over an X-ray report to him after I fell. They told me it looked okay, but he never got the result. So anyway, the girl in his office said that it would just be better if I came in to see him. So I did. And I feel better because he looked at the X-ray and he said that everything looked fine. I didn't, dislodge anything from the surgery. The hardware looks okay. And I asked him if I had started to fuse yet, and he told me no. What he compared it to was when you plug your lawn, like when you resawed your lawn, and you put the plugs in and they're kind of spaced apart. And then eventually the sod comes together and grows together and fills in. He said that when you have a fusion and you have the grafting, that it looks like sprigs in the lawn, like sod plugs. And he said that's what mine still looks like. It still looks like plugs, and nothing has started to fuse yet. So that's just a little... I found that interesting. At 7 weeks, none of the fusion has started to take place. So I guess I still have a long ways to go. I'm still wearing my brace, of course, every time I get out of bed. And I had him check my brace because down at the bottom of the brace, it really, when I tighten it up, it really digs into like my lower back and the top of my butt. And it can be really uncomfortable when I'm up for a while. So he told me that I could go over to the brace, back to the brace place, and have them adjust that. So I did, and it's a lot more comfortable now. Anyway, he told me that I need to get back to walking. He said it's really important to be walking. He wants me walking every day. And like I said before, he said he wants me to work up to 2 miles. I told him that I had cut back on walking since I fell because I've been in so much pain. But, this morning I went ahead and I got up and I went to the Y. I did 3/4 of a mile, and the speed was at 2.7. So, it's a moderate speed. It's not slow. It's not fast. It's just a comfortable walking pace for me. And I felt okay walking. I took one of it's called Norco. That's what he has me on now. It's a light dose of hydrocodone combined with acetaminophen. I took one of those and 3 ibuprofens, and then I'm still taking Lyrica, 150 milligrams 3 times a day. And he said you can take as much Lyrica as you want. Well, I take it as prescribed, but that's what he said. He said he has no problem with the Lyrica. He also gave me Scalaxin to take as a muscle relaxer as needed, and I take that a few times a day. But he said about now is when people start transitioning off of the narcotic just onto Advil. That's what he prefers. So I'm having a little bit of a struggle with that because whenever I try to cut back, once the pain gets out of control, it's really hard to get back under control. So the good time of day for me is in the morning. I told him that. In the morning, I do pretty well. After I've rested all night, my back is nice and relaxed. I wake up in the morning and it's not bad at all. And but I'm sore because I've gone all night without any medication. So I go ahead and take my medicine in the morning. And once I start to get active during the day, I get sore in the afternoon. By evening time, I'm usually hurting, and it's really the worst. My pain is the worst when I lay down at night to go to bed, and it's really hard to find a comfortable position. And last night my pain probably got up to about an 8, 7, 8. It was really uncomfortable. And I had taken the medication in the morning, then I took it again maybe late afternoon. By that time the point is I should have taken it earlier, because by that late afternoon it was already pretty well out of control, and then it was just really hard to get under control last night. I was up until about 2 in the morning last night. So, but like I said, I got up this morning, I went to the Y, I did 3/4 of a mile with taking one of the pain pills and 3 Advils. And then, let's see, it's about 1. I took one about an hour ago with more Advil, and I'm doing okay. I'm hurting. It's not the end of the world. My pain now, it's on the right side of my back, lower back, right side of my butt, really in my hip and the top of my thigh, that outside of my thigh, top of my thigh. Sometimes I just rub it and rub it and rub it. But that's where it hurt before surgery, so I imagine it's still the nerves healing. And sometimes when I lay on my right side, I get a sharp, like a jolt down in my calf and in my foot, like my outer toes. I'll get some sharp pain still. And there is one area on the left side of my butt where I still get some sharp pain from time to time. But really right now it's just like that deep gnawing, burning kind of a feeling in my hip and my thigh. So, I definitely feel better than I did like after the fall when I was having that pain. It's better than that, but I'm still pretty uncomfortable, and just trying to tolerate the pain, knowing that, I've had surgery, the nerves aren't pinched anymore, and trying to have patience. Just like he said, you got to have patience. Sometimes it's hard when you're hurting to be patient. It's not the easiest thing. So that's the update. I'm going to be trying to cut back more on the pain medicine, and I've already dropped down. Like when I first came home from surgery, I had the extra strength Percocet. Then I went down to extra strength Vicodin, then the regular Vicodin, now down to this Norco. So, I have cut way back, and I only take one of those. Rather than 2 is what I'm saying. I take one at a time along with the Advil. So I've come a long way, and it's just trying to be patient. I'll follow up with the doctor in 6 weeks. So my appointment is December 20th, and before I follow up with him, I have an X-ray scheduled, another X-ray. So I think I figured out that X-ray will be taken at 12 weeks post-op, or 13, maybe it's 13 weeks post-op. Anyway, 12 or 13 weeks post-op, 3 months. And hopefully by that time, if I continue to do my walking, hopefully some of that fusion will have started to take place. So I'll keep you posted on how everything's going, and good luck to everybody that's going through this. And I really appreciate your comments and your support, and it just means a lot to know that you're not going through this alone, because really before I saw the YouTube video diary that I watched that helped me so much, I was so isolated and so depressed, and not working, just feeling like I was losing my whole identity going through this. I didn't feel like I was a good mom. I didn't feel like I was productive in society. Couldn't keep up with my house, my finances. It's really, really tough. So just hang in there. There's hope. It does get better. And take care, everybody, and keep in touch. That's it for now.